Hello, everybody. This is Gary. Today is Friday, November 29th, 2019. It is 4:13 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia vlog entry for today. Today, I wanted to talk about if you have a mental illness, whether it's a psychosis like schizophrenia, or schizoaffective disorder, or a mood disorder like bipolar disorder or depression, or an anxiety disorder or a personality disorder, what do you do for treatment if you live in an area where there are no psychiatrists or psychotherapists available? Well, I found myself in that position for about 5 years. Right now, I live in Rochester, and there's a fair amount of outpatient clinics that I could go to for psychiatric treatment where they actually have a psychiatrist available. A psychiatrist is somebody who has a 4-year medical degree plus several years of psychiatric training, so they have the same medical degree that any doctor would have, and they can prescribe medications. Um, there's also psychologists which have PhDs in psychology, but they're not medical doctors. The term doctor refers to their PhD, and they can't prescribe medications in general, as far as I know. Um, but I used to live in a rural area, not too far from Rochester itself. I lived in Brockport, New York, which is a fairly good-sized town because it's a college town. The State University of New York at Brockport is there, so there's quite a few people, quite a few students. It's not like a completely desolate, abandoned area like, I don't know, Idaho, where there's hundreds of miles of nobody around. Um, but still, Brockport was still pretty rural by New York State standards. Um, and I had to continue my psychiatric treatment when I moved out to Brockport. I moved out to Brockport originally because I had a nice apartment with subsidized housing that I was accepted into, and I just wanted to get out of the city. So I moved it's about a 30-minute drive out to Brockport. Um, and I found myself in a situation where I couldn't find a psychiatrist. The only psychiatrists that were available in Brockport were in private practice. And I don't have the money to pay for a private practice psychiatrist. And no private psychiatrist that I'm aware of takes Medicare and Medicaid, which I had both of at the time. Right now I have Medicare without the Medicaid. But I couldn't find a psychiatrist that worked in the clinic setting where they took in people who were psychotic or severely depressed. Um, where I go now is a place called Strong Ties. It's part of Strong Memorial Hospital, University of Rochester. And I go there to see my psychiatrist and get my meds taken care of. Um, I presently don't have a psychotherapist, um, which is really just somebody who does talk therapy. Um, but in Brockport, I found myself not being able to find a clinic that had a psychiatrist or even just one psychotherapist. I ended up for about 4 or 5 years getting my medications prescribed by a medical profession in New York State known as a physician's assistant. They're sort of like nurse practitioners. They can prescribe medications even though they're not full blown medical doctors. They can still write prescriptions for drugs because they obviously have some medical training. So I was going to a clinic in Brockport, New York that had one therapist for the entire town. So I never actually got to see him. He was just too busy and there was no practical way to stay in treatment with him. And so I was going to this medical clinic where my primary care doctor was. And I was getting my prescriptions written by people who were not psychiatrists or even psychiatric nurses for that matter. Um, the town was isolated enough that the medical doctors there at the clinic that I went to, um, a lot of them knew that their situation and position as a doctor was unique in that there were no psychiatrists available for people who were mentally ill unless you had a lot of money to pay for a private practice psychiatrist. And so the doctors were flexible at the clinic as far as writing prescriptions that were psychiatric drugs. because I was on Seroquel, it's an antipsychotic. I'm still on Seroquel, and my primary care physician or the physician assistants would write my prescriptions for my psychiatric drugs, neither of whom was a psychiatrist, nor even a psychiatric nurse for that matter. So I lived in a fairly rural area, and got my medication from my primary care physician. And if he wasn't immediately available, I would go to the physician assistant, and she would write my psychiatric drug prescriptions. And I actually did pretty well that way. It helps the fact that I was stable enough not to need a psychiatrist and not to need a psychotherapist. Um, I haven't felt stable in a long time, but I was certainly stable in Brockport. And you have to be fairly stable if the person writing your prescription isn't a psychiatrist. Um, but I made the most of it. I was stable. I took my Seroquel. I took my medications. I even took Clonopin, which was a controlled substance at the time, and the physician assistant was writing a prescription for that. Now, I know a lot of psychiatrists and psychologists out there and psychiatric nurses are going to get mad at what I'm saying, that you shouldn't see anyone but a psychiatrist or another psychiatric provider for your psychiatric meds. And that's just not realistic. Rochester, New York is a fairly big town, and even the clinics that they have for psychiatric care are somewhat overcrowded. That's an understatement. That is, they have lots and lots of outpatients um, crowded into the clinic, and it's not even necessarily easy to see a psychiatrist when you live in the city because it's overcrowded. Um, and living in a rural area, sometimes it's just not possible to see a psychiatrist or a psychiatric nurse or some other professional that's trained in psychiatry and can prescribe meds. A lot of people are going to get mad at me saying that, but the truth is that if you live in a rural area, you have to make do with what you have. And what I had at the time was my primary care physician and the physician assistant. Um, because even my primary care doctor was busy most of the time because he was a primary care doctor at the clinic. If I wanted an immediate appointment, I ended up seeing the physician assistants anyway, and she would write my prescriptions for Clonopin, Seroquel, Clonidine, and whatever other drugs I was on at the time. Um, so you make do with what you can. And most medical doctors that live in cities, rightfully so, would not write prescriptions for psychiatric drugs. But like I said, Brockport was a fairly rural area, and the doctors at the clinic that I went to had to be realistic about where was I going to get my psychiatric medications from, and that had to come from my medical doctor. Otherwise, I wouldn't be taking medication. And I think everyone would have agreed that my being off my medication would be the worst choice to make, and therefore I had to make do with what I had. Um, and besides, because the doctors at the clinic I went to were used to seeing people that didn't have a psychiatrist. They actually had some experience in psychiatry that's sort of like informal, as they would talk to patients and write prescriptions for them, taking their best guess at what the best medications were. They themselves had some psychiatric experience simply by need of necessity. They had to be flexible about prescribing drugs, and the patients had to be flexible about not having a psychiatrist. Um, so sometimes you have to see anyone who can write a prescription for your psychiatric drugs. Um, Eventually, I moved back into the city, and I started going to the Strong Ties Clinic here in Rochester, and it's fairly overcrowded. It's hard to get an appointment with a psychiatrist. Um, and I think it's partly overcrowded because medical doctors inside the city generally don't write prescriptions for psychiatric patients. They would leave that up to the patient's psychiatrist. Um, but that's all for now. I just wanted to point out that if you live in a rural area, a town that's smaller than a major city, sometimes you have to work with what you got. And it may even actually work out because I did this for like 5 years without seeing a psychiatrist, but still taking my psychiatric medications. Um, there's parts of me that wishes I could still do that. It would make things a lot simpler. But my primary care, the one I have now, would refer to me would refer me to my psychiatrist if I had any problems with my psychiatric medications. And that's the way it's supposed to work. But like I said, in a rural area where there's nothing but grass and cows around for miles, you gotta make do with what you got. So comments, suggestions, share, like, give me suggestions if you want. If you have any idea for a video you want me to make, let me know in the comments section.